Hi, I'm Marian LaSalle, and this is Steve Baker, and we are on the Healthcare Peace of Mind TV show, and we're here to explain a little bit more about Medicare and how it works for everybody involved. Today, Steve is going to answer some very specific questions. So, good afternoon, good day, good evening, good morning, wherever you are in the world, whatever time it is, I want you to know that you're in good hands when we're talking to Steve Baker from bakerseniors.com. Hi, Steve.
Hi, Marian. Good afternoon.
It's afternoon here, but you never know.
That's
Whoever's
true.
watching this could be,
That's
it
true.
could be morning. So, Steve, I know that we've had quite a few shows, and there's a lot of different topics that we've covered. But as a review for those people that have not seen this show before, can we go over the 4 parts of Medicare?
Sure.
And could you explain each one?
Sure.
Thank you.
Be glad to. This is universal across the country for Medicare, and anyone turning 65 is eligible to participate in Medicare. At 65, they're automatically enrolled in Medicare. So, assuming that they have 40 quarters of work, and if not, they can use their husband or their spouse's 40 quarters to participate. But generally, you can say pretty much when you turn 65, you're part of Medicare. That doesn't mean that you're automatically enrolled in all 4 parts. The first part is Part A of Medicare. And Part A of Medicare is paid for over the years as payroll. When you receive your check, your paycheck, what happens is you have a payroll deduction, and that pays for Part A through the years. So by the time you reach 65, Part A is all paid for. Part A is for pretty much, let's say, hospital and hospital-related instances. If someone is checked into the hospital for surgery, or if they've been in an accident, then Part A pays for the hospital room and hospital room only. There are a few more things that Part A could pay for. In the end care, Part A will pay for hospice care for someone. So those are the 2 major areas. And also, if someone needs skilled nursing care, say they've had surgery or something like that, knee replacement or something, it pays for 20 days of skilled care. So that's important as well. So that's Part A. And as I say, there's no cost for that. Part B of Medicare is pretty much all of Medicare. I'm going to say 90% perhaps of Medicare is Part B. Part B pays for doctor's visits. It pays for examinations. It pays for tests such as MRIs, CAT scans, blood tests, x-rays, all of that is paid for through B. It's the most used part of Medicare. Surgeries outside of the hospital, day surgeries of all sorts, such as replacement of the lens of the eye. All of that's done, usually day surgery. That's paid for through B. Now there is a cost for Part B, and it's a cost that everyone bears if they're enrolled in Medicare Part B. It's for 1916. That's 1916. Let's try 2016. That might work better. For 2016, the premium is $104.90. And that's pretty much across the board, unless someone happens to be fortunate enough to have a large income, such as $2 or $3 or $400,000, in that case, it's more than 104.90, and in some cases, a lot more than 104.90. There's a scale. I'm not going to go into that scale, but for the most part, generally speaking, I'm going to say normal waged people, 104.90 is the premium for Part B. Then there's Part C. Part C is the famous Medicare Advantage part of Medicare. And someone either participates in traditional Medicare or they participate in the Medicare Advantage. And there's some cost involved with that as well. For participating in Medicare Advantage, there is zero premium. However, there are co-pays and there are deductibles and some major disadvantages to Medicare Advantage. One being that you may or may not be able to see the doctor that you've been used to for years. Doctors move in and out of the plans. Sometimes they fire the plan, and sometimes the plan fires the doctor. So you're at risk of losing your long-term association with a physician by participating in Part C. You are assigned a primary physician that you must see in order to get a referral for any kind of specialty. So if you need to see an orthopedic person, then you must go to your primary physician. If you need to see an eye doctor, you must go through your primary physician. So there's some tricks and tumbles in Medicare Advantage. There are some advantages too. So that, it works like that. Then there's the Part D. We've done A, B, C, and now D. That's the prescription part of Medicare. I'll say right off that if you're in most Medicare Advantage plans, your Part D is embedded inside that. So you don't have to worry about the fourth part if you're part of Medicare Advantage. So now in Part D, in Texas, as an example, other states, it may be different. It probably is different. There are 41 different companies that offer 2 or 3 plans each in Part D. It's somewhat complicated. However, there is a simple process to determine which one is available or which one could work best for someone. So those are the Part 3 or the Part 4 parts of Medicare. So and as I say, there's some advantages and disadvantages to each, and there's no really easy way to determine it. When someone reaches age 65 or they're approaching age 65, something happens strangely to their mailbox. It starts filling up with all kinds of different things, all size envelopes, little envelopes, big ones, thick ones, all colored ones, brochure size. You could start a bonfire with it. And I've been in many, many homes where they have a big stack of, just a huge stack of mail that they've received. And it's what I call piles of confusion. People just really don't, there's a couple of things that could be done. One is you could just put your hand over your eyes and reach in and pull one out, and maybe you can join this plan. Makes about as sense as anything else, because there is a nice medium-sized book called Medicare and You that someone receives, and once you do that, once you start looking into that, you say, "Oh my Lord, how does anyone figure this out?"
Well, that's a good question I have for you. So
Okay.
how can someone really know which is best for them as they're getting ready to reach that age of 65?
Mm-hmm.
How do they know if it's so confusing?
Well, one of the things that they can do is that they can speak with someone like me. I have a major advantage over a lot of other agents that work in the business. My major advantage is that I myself have been receiving Medicare for many years. So I'm able to explain to the people as I go sit down with them how it's worked for us, my wife and I. I'm a cancer survivor. My wife is a cancer survivor, and I've had a quadruple bypass. So I've got a lot of experiences. I got a lot of stories to tell about Medicare and what it does, and demonstrations on bills we received through the years, and this is what you can expect, and so forth. So I'm quite experienced in the world of Medicare, so I can help people so that they can understand it and give them peace of mind about the choices that they make. If someone does it on their own, they may or may not make the right choice. So peace of mind is very important, especially with healthcare, no question about it. And I'm willing to go through it free of charge with anyone and explain it to them, especially in the Houston area. I can get in my little car and head over there and sit down with you for about 15 minutes. And after 15 minutes, all the clarity will come to be.
Excellent. Well, that's good to know. I have another really deep question here, because this is very concerning and very confusing. What if somebody has made a decision? What if they made a decision and they didn't look back, and now they want to change, or they're not sure if they should change?
Okay. All right. Let's say someone has chosen a Medicare Advantage as an example. And this may or may not happen, of course. Within 12 months after enrolling in a Medicare Advantage, if they're unhappy with it, for let's just use an example. Let's say that someone has to go in for a knee replacement. They've had problems with their knee for quite some time. They enroll in a Medicare Advantage, and all of a sudden, it's reached the critical stage, and they say, "Look, I just can't stand this pain anymore. I've got to go have it replaced." And they do that, and once they've enrolled in Medicare Advantage, someone may have to pay $800, $700, or $1,000 to get in the hospital, even with the Medicare Advantage, as opposed to traditional Medicare, where they really don't have to pay anything except one small deductible of $166 for the year. So they do that, and the surgery, they have to pay a portion for that. The bills start ticking up. Go into your doctor, you got to pay for a doctor visit, a portion for the doctor visits, and over the process of that, they've paid several $100s, maybe as much as $2,000 or $3,000 for that knee replacement. So they're really unhappy with it. Within a 12-month period from the time they turn 65, and if they've enrolled in a Medicare Advantage, they can reverse that. However, after 12 months, it's very difficult to do so. It can be done, but it's not easy. And it's not easy to move back.
Another reason to contact you before they turn 65, so they know all the ins and outs and make good decisions.
Correct.
Steve,
that's the way it works.
What advantages do you offer over people just like you out there selling Medicare insurance?
Well, the advantages are that I can explain it in clear language, so that they can have a clear path to a decision. And as I say, everyone needs and wants peace of mind. And I'll point to whoever's watching this video, and I'll go like this: you deserve peace of mind for your health. And I'll show you the quickest path to that peace of mind. And by using, me as an example and my wife, I'm also a veteran. So I've been in and out of the VA, and I can explain how that works too. And as compared with Medicare, everyone who's a veteran needs to know that as well. So there are a lot of advantages for no cost. And someone will say, "Well, come on, hey, I've lived a long time. There's not anything for free."
I was
There's got
just
to be
thinking that. What do you mean no cost?
there's got to be there's got to be a catch. The fact is that I'm actually a licensed insurance agent. So when I help someone and move them into a plan, I get paid. If they decide not to move into a plan, and if they decide not to do business with me, fine. Hey, we shake hands, leave as friends. No problem. But I can help them, and when I do help them, I get paid, not by them, but by the insurance company. So that's the trick right there. And it's true for anyone offering a service like this or any company. Obviously there's going to be a payment made, but it has to be the proper payment for the proper person with the proper coverage so that everyone's happy.
Okay, so let's review everything we learned today. We learned that there are at least 4 parts to Medicare: A, B, C, and D. There are other parts, but those are the main ones. We've learned that there is a cost for some of them. Some of them are free or included in
Right.
money that we've already paid in,
Mm-hmm.
and others cost money. And we've also learned that there's 2 different types of Medicare. There's an Advantage and there's a regular. Is that what you call it? Regular?
Traditional
And Advantage. And we know that once a decision has been made, it's hard to change that decision. So you need quality information from someone who's experienced, like you, to make the right decisions from the beginning.
Correct.
And if there's ever a change, they need to call you to make sure that they make those correct changes.
Has to be done properly.
There you go. Mm-hmm. And that you offer a free service where you'll talk to them about all the different things that they might not know or are confused about. And Correct. If they're in the Houston area, you'll even drive to their house.
Correct.
That is amazing. Mm-hmm. Well, is there anything else that you'd like to add? We've covered quite a bit today.
Mm-hmm. Well, I will point out that I'm not appointed with any of the companies that offer the Part D. Some agents are, but I'm not. So what I do there is I will sit down with them and help them one of 2 ways. I will even show them how to call Medicare, and we can do it that way, or we can go online and I can help them with their Part D there. Part D is probably the most complicated of all the portions of Medicare. And I've done hundreds of those. So I know, and I'm on Part D myself. My wife is on Part D. So I know how it works, and I know the ins and outs of it. And that's one part of Medicare that can be changed each year without too much issue. But it needs to be reviewed on an annual basis. And just because someone gets in, it's not a set it and forget it kind of program. Someone needs to be aware that each year the Part D needs to be looked at. And then there are always changes in Medicare. Each year there's something changing about it. So someone needs to be plugged in with someone like me. So if they have any questions at all, they can just give me a call and I'll be glad to help them and answer their question, or even come out once again to their home and review what the issues are.
And Steve, how do they get a hold of you if they have questions?
I can be reached at this phone number, 832-754-3292.
Do you have a website where they can get more information?
BakerSeniors.com. bakerseniors.com.
Okay.
And I'll be glad to come out. And I'm not a salesy person, so I just give you information that's of a major advantage to you, and I just let someone make up their own mind about what direction they'd like to move in, and I can help them either way. Whatever they want, you decide is fine. I can help them. And by the way, I can, for their zip code, I can give them the best price available for a Medicare supplement. Medicare supplements, by the way, are all equal. They're all the same. They all do the same. They all pay the same. They adhere to what's called CMS guidelines. CMS is the Center for Medicare Services. That is the administrator for Medicare. So they must, all companies must pay their claims, and they all do. So they're all the same. And I can explain, we're not going to get into it now, but I can explain the major differences between Plan A, Plan G, Plan N, Plan F, all of those different plans. I can talk to them about that as well. And I can tell them what plan I have and what I've had for years, and what plan my wife has and she's had for years, and how it's worked for us. So
no wonder the name of your show is Healthcare Peace of Mind.
Healthcare Peace of Mind.
You truly do allow us some peace of mind when it comes to choosing which Medicare supplement or deciding which Advantage, traditional. There's a lot of moving parts, so you can clear it up. So thank you very much, Steve.
Thank you. I enjoyed it very much.
Until next time, we'll see you soon.